Vestibulodynia, which is pain around the vaginal entrance, usually described as a burning, stinging, ripping, sharp type of pain, usually with touch, with initial insertion, etc., is a little bit tricky and complicated to treat because there are a lot of underlying sort of sub-causes that could be going on. So let's talk about some examples. One is inflammatory. Inflammatory vestibulodynia happens when somebody has had a lot of repeated infections. This might be yeast infections, this might be bacterial vaginosis, etc., but just a lot of infections that cause an inflammatory response, and somebody gets a lot of nerve irritation. Sometimes that turns into inflammatory neuroproliferative, which is where mast cells basically cause us to grow more nerve endings in that vaginal entrance to cause an increase in pain. There's congenital neuroproliferative, which is where somebody is just born with an increased number of nerve endings there. There is vestibulodynia that's caused by increased tension in the pelvic floor muscles. So as those pelvic floor muscles are really hypertonic and tight, they cause basically a lack of oxygen and blood flow to that area, which can increase nerve irritation and sensitivity. There are also skin conditions, things like lichen sclerosis, which causes the skin around the vulva to become very fragile and sensitive and uncomfortable. That can also cause vestibulodynia. And there is hormonally mediated vestibulodynia, which is where a decrease in estrogen and sometimes also testosterone can also cause those nerves to be painful. This often happens postmenopausally as people lose estrogen, but it can also happen while breastfeeding. It can also happen when somebody has been on a birth control for a while, or even something like spironolactone. So treating this condition can be a little bit tricky, but it helps to figure out the subtype or some of the potential reasons that it could be happening.